Hi folks, I'm Dr. Tom Meade. Welcome to our show. I'm here with Dr. Eric Lebby, Chief of Orthopedic Surgery at Lehigh Valley Hospital, and we are looking at COVID-19 as seen through the eyes of our surgical patients. A year ago, Eric and I sat here in the midst of the pandemic when all things were changing. Elective surgery was shut down for 2 or 3 months. Office visits were minimized. We learned about telehealth. Our whole orthopedic world was turned upside down. But never in our mind did we think this would be going on for a year, Eric.
No, and it's still going on in a way.
It's still going on. So it's amazing the variety of patients we had. So we thought it would be much better, instead of listening to us, to listen to our patients and their experience through the eyes of their surgical experience at our 2 hospitals. And we have a bunch of patients with a bunch of different experience, and we're sort of think that that's the most important thing for you to hear. So I'm going to get started with a couple patients of Dr. Lebby's, and please enjoy.
Let me ask you a question. Did you feel like your surgery was essential?
Yeah. I was in constant pain.
And if somebody had told you, we can't do the surgery because, of, say, COVID, how would that make you feel?
Well, I didn't even consider COVID.
Okay. How did you feel at the hospital at our Tillman site? Did you feel like that you were safe at the hospital?
Yeah.
So what would you recommend to patients that are thinking about having hip or knee replacement surgery during this pandemic?
If you're in pain, get rid of the pain.
All right. Why don't you stand up for us, Jim? Can you do that for me? And you're 3 weeks out from surgery, right?
Yep.
That's pretty darn good. And you're looking good, Jim, okay? Thank you very much for this interview. I really appreciate it. And again, thank you so much for your service.
I don't think a lot of patients realize that at 3 weeks they will feel that great. Again, they look at the recovery as taking a long period of time. But I think the take-home message here is trust. When they trust you as the orthopedic surgeon, they trust that you picked the right hospital for them. You could tell how confident he was. He had no concern at all because Dr. Lebby picked the hospital where you knew all the pathways, the precautions, and it's just a great example of the ultimate trust in their orthopedic surgeon.
Yeah, no doubt. And again, it shows that this was essential to this gentleman. He needed his life back. He said, I'm getting this surgery done. I don't care about this. I don't care about that, because again, essential. And this is a patient who is at a higher risk, right? He's not 22. He's not 35. He has a couple comorbidities, and he went through it fine. He's 3 weeks out. He's 21 days out from surgery, and he is walking around without a cane, walking around without any assistive devices, and he's doing great, doing his exercises. He's in outpatient therapy, and he's really doing exactly what he wanted to do.
It's interesting. One of the previous patients, they were in an essential business like fixing automobiles and running a garage. They were essential businesses during COVID. So it was essential to keep those open. But if the owner of that essential business needed surgery, that was not considered essential.
Yeah, correct.
Which is interesting.
It's very interesting.
So let's jump ahead to another hip replacement.
Alan, when do we do your hip replacement?
The December 14th, 2020.
Okay, so would you say that your surgery was essential?
Absolutely.
Okay, so you felt like life wasn't too good with the way your hip was feeling before the surgery?
No, it was pretty miserable.
And if someone told you that you couldn't have the surgery because of any reason, that would not be a good thing for you?
No, it wouldn't have.
Okay. Did you have any concerns or worries about having the hip surgery during these times of the pandemic?
I did not, and I actually had COVID-19 prior to surgery.
And when did you have it?
November 1st.
Okay.
of 2020.
And the surgery that we did was, what was the exact date?
December 14th.
Okay, so that was almost about a month afterwards. Okay, great. So what was your impression of the safety and precautions that Tillman Hospital did in order to make you feel safe?
I mean, everyone had masks on, and as per usual, and I've never really been afraid of the COVID. I've been careful. You get it, and that's the way it is. And you know, I recovered well. And but as far as the hospital, everything was safe and clean, and I felt 100% safe. Yes.
What would your advice be to a patient that is considering joint replacement surgery now, but is scared because of the COVID virus?
I would tell them not to wait. Everything's safe. Again, like I said, everything's clean. Everyone had masks. That there's no sense of living with pain when you can have this done now and feel safe, and it is safe.
And how quickly did your hip feel better after the surgery?
The first week was a little tough, but after that you start going through therapy, and it progressively gets it heals very fast. In fact, I'm a plumber, and I went back to work in 6 weeks.
That's fantastic. Any other comments or advice to potential patients that are out there?
No, just don't fear and do this. It's worth it. Your quality of life will it will be much better. That's all.
Great. Why don't you stand up for us? I want to show the viewers out there how you're doing and how you feel. Why don't you take a squat down?
Squat down.
Yep. And why don't you stand up and take a walk to the door? All right, Alan. Well, thank you very much. I'm glad everything's going well, and I'm glad that you could help educate our patient population, because there's no better story than one that comes directly from one of our patients. So I thank you.
Thank you.
Again, it's a great result. Here's a small businessman who got hammered during COVID. So, here's a guy that struggles to make a living, and because quote, non-essential surgery like a hip replacement was put on hold, they have to suffer through that. And it's not just benign. How does he get through that? Well, he's got to work, he's got to support his family, so he takes anti-inflammatory medications, which have their own side effects. Some people require narcotic pain pills, which can add a whole different ball game to this. But he's a great guy. You got him in. He had COVID. Yeah. He had COVID.
And that's one of the reasons why I included Mr. Howie in this, because he had COVID, and a month later, he's having elective surgery. And again, this isn't a gentleman that sits at his desk and listens to Zoom calls during the COVID crisis. This is a plumber. He does manual labor. He lifts heavy things. He gets down into crawl spaces. I don't know if anybody has actually witnessed what plumbers do, but it's some crazy stuff. Whether you're a plumber, HVAC, car mechanic, truck mechanic, these guys and gals, they work really hard. And if you have a bad hip, you have a bad knee, tell them that it's not essential. That's their livelihood. That's putting food on the table for their families, and that's, like you said, that's their possible small business. I mean, that's why these surgeries, looking back, we kept using that term essential and non-essential. I mean, who's to say what's essential and what's not? It's really for each person to decide with us what's essential and what's not essential.
It is absolutely through the eyes of the patients, and their life is essential. There's nothing more rewarding after doing sports medicine for many years and still doing some of that. It's great to get athletes back to the field and playing, but there is nothing more rewarding than getting people back to their life, back to their livelihood. I mean, this is the essence of really why we trained and what we do. I mean, it's doing interviews like this in your office, it just has to make you feel so great when you see this.
Well, this was a great exercise because a lot of times we can forget, right? You're running around the office all day. Whatever you do, whether you're a banker, a lawyer, you tend to sometimes forget your purpose and what you're doing. And interviewing these patients really let me know that you know, I'm helping people and they're very happy, and we're doing a service that does a lot of good for a lot of people out there, and it really makes you feel good for them, you know, even more than ourselves.
I agree. I think my next patient is a retired gentleman, and it's interesting. He has a special condition where he's hard of hearing, and he'll talk about how difficult that was during COVID. So stay with us, and you'll see Carl next. Welcome back. Let's listen to Carl's experience of undergoing a total knee replacement during the pandemic. So Carl's one of my patients that had 2 knee replacements, one 5 years ago and one during the pandemic, Carl, and that was 5 weeks ago. So I want to ask you about that one first. Number one, the pandemic is almost a year old now, and they shut down elective surgery a year ago because they considered it non-essential. So I just want to ask you, would you consider your knee surgery non-essential?
No.
So you would consider it essential?
Yeah, for me, yes.
And why is that?
Because of my quality of life, of the things that I enjoy doing. Again, a lot of biking, a lot of hiking, walking, and I found that I could not do that anymore.
And so for you, it was essential to have this operation during the pandemic?
Yes.
Yes. Did you have a vaccine before the surgery?
No, I did not.
No. So did you have any concerns about having your surgery during the pandemic?
Absolutely not.
And why is that?
Everything. A well-oiled machine, putting it bluntly. I had no issues.
So you weren't worried about the risk of catching COVID or any of that?
No.
Great. And so as you know, our hospital at Coordinated is purely an elective hospital. We don't treat active COVID patients. What was your impression of the precautions taken? Were you comfortable with the precautions taken?
Extremely comfortable, yes. All the nurses, the staff, they were great. Again, I'm hard of hearing, so the nurse I had was he was wonderful. So I can't say enough good things about it.
And talking about hard of hearing, one of the things I noticed during the pandemic is wearing the mask. Somebody like you probably uses reading lips as part of your ability to compensate for your hard of hearing. So that has to be hard for you.
That's absolutely correct. In fact, with the mask, the type of hearing aids I have, I could not wear because half the time I would lose them.
So we did your other knee 5 years ago, and you were an inpatient at that time. You stayed in the hospital, is that correct?
Yes, correct.
And why was that?
I had a huge cyst on the back of my knee. And I had to stay in only because they had a drain tube in there. So that stayed in for an extra day. I had to stay in overnight until the following day.
And this knee was done as an outpatient. So how long after the surgery were you home? Do you recall?
About 2 hours.
About 2 hours.
Yep.
Would that be your preference to have it done as an outpatient?
Absolutely.
And how about our pain management program the first 2 days? How did you do the day of surgery and the next day?
Actually, really good. It was probably the third day is when a lot of the pain relief that was given before I left kind of wore off, you know, and then that's when the pain really gave in there. And again, I could not use the opioids, so I ended up using the Tylenol, and then of course I'm on naproxen, so I dealt with it.
And that's exactly what we predict with patients. First and second day, you do great. Third and fourth day is when it can hurt a little more. So the difference is we give you a week's worth of narcotics versus 6 weeks, which was historic, just because of the intrinsic nature of the opioid problem. So you did great with that. How's your motion? Can you straighten out your knee for me? And that's at 5 weeks. Can you bend it back as far as you can? Great. Can you stand up for me? Get up on your toes. Yeah. Can you hop a little bit like you're jumping weight? And that's at 5 weeks, correct?
Mm-hmm.
How about therapy? Did you go to therapy?
I did.
And-
I had 5 sessions, and matter of fact, the last session I was at, he said, "You're probably going to release me from the PT because."
So you're doing great.
Yeah.
You're doing great. And what's interesting is our therapy protocol has changed too. So for the first week, you did it on your own at home, which
Correct.
I think is more comfortable. I think the patient knows their own pain and swelling. What kind of work did you do, Carl?
I would say I worked for the city of Allentown.
What would you tell other patients that are looking to have a hip or a knee replacement during this pandemic at this point? Would you have any hesitancy in telling them to go ahead?
I would not.
And why is that?
Again, that's the quality of the hospitals, the quality of the people who work there, the nurses, the doctors, everybody was 100%.
So he hit all the touch points. You know, for him, you know, they worked 37 years for the Water Authority in Allentown, and he's retired. He can't hike, he can't walk, he can't bike. It affects his quality of life, you know. So I think he was comfortable with the mask wearing. He did note he has some deficits, but we'll discuss that in a minute. Let's jump forward to another gentleman, and we'll view and listen to his experience during the pandemic, and then we'll discuss both of them.
So how many months are we out from doing your surgery?
3
We're
months.
about 3 months.
Yes.
So were you at all worried or concerned about the surgery, about COVID? What were your thoughts, you know, before coming and deciding to have the surgery?
I wasn't worried about anything at all.
Just give me some information on, you know, why you felt safe when you were at Tillman.
Well, it was just they were taking all kinds of precautions for everything, and I just knew that I'd be okay coming in here.
So when you say precautions, what kind of precautions were they
They were
taking?
wiping everything down and everything the whole time, and they had their masks on and everything too, and just took care of me quite well. You know, I had no problem with anything at all. You know, I wasn't worried about anything.
So never at all did you worry about safety or worry about you know, coming down with something or feeling unsafe?
No, not at all. Not at all.
And before you went to the hospital, did they test you for COVID?
Yes, they did.
Okay. So, and did that make you feel a lot more comfortable?
Sure
Okay.
did.
And how was the nursing staff at the hospital?
Great.
Were
They
they
were great. They were
Okay.
great.
good?
Yeah.
And how about your post-op? How was your post-op treatment with physical therapy? Did you feel okay and safe in physical therapy?
Yes, I did. I have a real good group of people right down the road from me, a quarter of a mile away, and they took care of me quite well.
Okay. And just 3 months after that surgery, why don't you tell the viewers what you did during that big snowstorm?
Well, out front, our sidewalk there's about 150 feet of sidewalk, and I shoveled mine, I shoveled my neighbors below, and I shoveled the neighbors above. And after I was done, the neighbor on the other side of the street, he called over to me and he told me, he says, "Rich," he says, "if I ever need a knee replacement, I want the name of your doctor." And I just had a laugh. So,
Well, thank you for that. So, if you had something to tell the listeners out there, or people viewing this show about, you know, whether or not to decide to go to the orthopedic surgeon to have a knee replacement done, what would you tell them now?
well, I would tell them I should have had these done about 6-7 years ago, and I put it off and put it off. And my best advice to you would be, if you need it done, get it done.
And how about during this time of COVID? Do you think that should hold anybody back?
I don't think so. No.
So you felt safe.
Oh,
You
yes.
felt like
Yes, totally.
you felt like this was good. And anything else to say about the Tillman facility that you're at, the Lehigh Valley Tillman facility?
come here. That's all I have to say, is come here.
All right, Rich. Well,
Yeah.
thank you very much. I'm glad you're doing. Why don't you stand up? And just show the viewers, you know, how you're doing. Take a squat. Can you squat down? Excellent. All right, and just take a walk for us.
So that's a tough guy shoveling. I did a quick calculation. His 150-foot sidewalk times 3 is 450 feet. That's like a football field and a half
Yep.
of shoveling 24 inches of snow. So that's a pretty good testament to a tough guy and a great result.
Yeah, I think both of those last two videos that you showed, you know, explain, you know, they're both older gentlemen. They're both very active. They're both, you know, healthy guys that want their life back, and that's really what they got. And something, you know, very interesting that I saw from your patient, you know, you don't think about hearing aids. You don't think about the hearing impaired. So he had the double whammy. The mask would always knock his hearing aids out, and most people now are wearing masks, and he can't, you know, he's a lip reader and he can't appreciate what they're saying. You know, so those things, you know, really have to be taken into consideration with these patients. You know, and again, you know, my patient shoveling, you know, shoveling that much. Your patient that is very active, looking forward to going to the Pigs games again. I mean, these guys and these women, you know, they want their lives back. And you know, we've been talking in this show and the one before about what's essential and what's not essential. You can't tell me that these surgeries that we and other orthopedic surgeons in our network are performing are non-essential. You can't, because you've witnessed countless patients today, you know, explain to you how they are essential. And you know, I really want the listeners, the viewers, and anybody out there watching the show to understand that, you know, we can do this safely, and you can feel confident now coming to your orthopedic surgeons at Lehigh Valley Health Network, whether it's LVPG Orthopedics, whether it's Coordinated Health Orthopedics. We care about you. We wouldn't be doing this if we didn't think and know you were 100% safe during and after the procedures.
Hello, Rich. How are you doing?
I want to finish and say that I learned as much from the patients by doing the interviews as listening to them, because you know,
Couldn't agree more with you.
we asked questions that we don't normally ask in our normal follow-up, and I'm going to continue to do this. So why don't we do that? Why don't we continue to interview patients, and we'll come
Maybe
back.
have one or two a show and just do a part
Let's
of
do
whatever
it.
our topic is. We do an interview.
Let's do it
With the patient. I think it's a
learned
great
a lot.
idea.
I love sharing with the audience. Thanks for joining us. We'll see you next time.